Hello everyone, welcome to the 10th episode of our Facebook live session. As we are celebrating Men's Health Week, we have a special discussion to all the men out there on the topic all about men's health. We are privileged to have Professor Dr. Mallikarjun Reddy, HOD Urology, robotic surgeon, joining us in giving his valuable insights and knowledge on how to maintain good health in men. Let us start the engaging and informative session with Sir.
Sir, why is men's health important?
I think I'll give you some real startling facts about men's health. Always we have been speaking about the fair sex health all these days. But the first thing which I would like to tell you all is men die 10 years younger than women as a on the life chart. That's number one. Number two, 80% of the men would have some amount of stress or a bodily problem over their lifetime, which they wouldn't speak of at all. And number three, over a period of aging in a man's life, a lot of changes which would occur, which actually have not been spoken about to anyone because they keep everything to themselves. So now to bring out those difficult scenarios out and then ease the life of men, we're now celebrating the Men's Health Week. So let's hope that we get some facts right and then a little advice on to how to improve men's health and have a happy life.
Very true, sir. We usually keep listening about different health issues of women faced by women, but men's health, yes, it is not spoken out much. What are some of the different health issues that are faced by men and how can they be prevented?
So let's look at two age segments of man's life. One is the middle age and then the elderly age. Now there are certain issues during middle age and there are certain issues which come up to the elderly age. During the middle age, the individual goes through a significant amount of stress, and then he has to run around to make the ends meet and then look after the family. So the major issues which they would find is, one is they would probably not be doing enough of physical work. Now that would actually eat into their muscle and then slowly they tend to lose their muscle. The stress actually takes a toll and then puts in a little hypertension and then diabetes into the body. Apart from that, they also have a significant amount of sexual dysfunctions which creep in either because of the stress or because of the diabetes and hypertension. And then smoking is another thing which actually a lot of people do, just not as a recreation but as a habit, thinking that it actually eases their tension. It actually increases the tension by causing a lot of other issues. These are one important things which actually happen in a middle age. The second other important thing is because of the stress, we see a lot of people who have incontinence or have frequency of urine more than incontinence. They tend to really pass every half an hour, 15 minutes. This is actually a response to stress most of the time. And then sometimes, of course, it is not. Sometimes it could be a neurological issue or sometimes it could be something like a prostate or any other problem. But this is one other thing which actually brings down their productivity. Another issue which actually creeps in the middle age is an existential crisis for them. So they are actually pushing themselves all along, forgetting about their own health, which ultimately would be a problem when they actually attain anywhere, go beyond about 60s. So when we look at the next segment of people who are the older age, when I talk about older age, I'm talking someone about beyond 60. The most common problem we encounter is the urinary problem, and the most common is because of the prostate. Now what happens with that is either they would be going a frequent urination or they would having incontinence or they would having urgency or they have to go run to the washroom to pass urine, and nocturia, or they wake up many times in the night. Now that itself is a big health problem for one reason, that once you wake up more than twice in the night, they tend to develop, their hypertension goes up, they have a very significant history of falls, then they also have a higher rate of cardiac problems. So nocturia is a problem which we have to tackle it appropriately. Now, another issue which at that age they would have is impotence. a lot of people have sexual dysfunction, either because of falling testosterone to a certain extent, or because of all the previous diseases or decrease in the blood flow into the penile regions. So we tend to see a lot of people who actually have sexual dysfunction. But this is one thing which people don't talk about. And now when people don't talk about, they keep it to themselves and they keep on mulling about it, thinking that this is something going wrong in me, yet probably it is an age-related process. Unfortunately, that mulling is not a good thing, because they tend to have a lot of stress which creeps in. Now, these are all things which are very simple and then can be treated very easily. How do we prevent that? I think to a certain extent, the only way of prevention is to keep fit and then avoid all the vices. But otherwise, at some point, these tend to creep into the body, and then we can treat them.
Rightly said, sir. Mostly lifestyle factors would play a role in promoting anyone's health. Sir, can you please list out few lifestyle factors that promote men's health?
Well, I think the key lifestyle factors, there is nothing specific to men's health. The key lifestyle factors will always be the same for every individual, whether a male or a female. And all of us know well that the key lifestyle factors are to have a balanced diet. I think one important thing probably in the diet factor which I would like to put in is, we are now seeing a fair bit of uric acid stones. This is because of the so-called higher protein intake which has been pushed through during the COVID. People actually have gone straight onto having more of protein and then only, and that actually increases the uric acid in urine and then causes stones. I think everything in moderation is important. Protein, somewhere about 1 to 1.5 grams of protein per kilogram per day is, I think, an average recommended daily allowance, and then I think the adequate amount of carbohydrates and all should be there. The other important lifestyle factors is, first thing is, need to quit smoking. Smoking is the one and only major issue which can cause a lot of diseases. I think I can list, all of you know that smoking can cause cancers, but I think you should know that smoking does cause bladder cancer, it can cause prostate cancer, it can cause kidney cancer. And then the other important issues, everyone knows that it can cause cardiac problems, but I think it's one major cause of sexual dysfunction and impotence in men. So the lifestyle factors are all the same. Have a healthy diet, balanced diet, have a good exercise, go around and then keep yourself fairly stress-free as far as possible.
Yes. How does age impact health, and what are the age-related diseases we can see in men?
Now coming in the age-related disease, again, I will probably get it into a middle age and then later age scenarios. The middle age crisis is one where now these days, what are the other things which I have listed before. Other than that, what I would like to put in now is, people are far more career conscious and then career oriented. So what's happening is, things have got delayed in terms of having a marital life. People who were marrying about 25, 26, 20, 25 years back, now the average age of marriage has gone up somewhere about to 30, 32, and that also includes the girls who are actually marrying quite late, around 27, 28. Now, what this does is, the prime time of a man is around somewhere between 25 and 30. Once you start at 30, the testosterone start going down and the sexual drive also comes down. That's number one. So we tend to see a fair bit of people who come back who are not very happy on their sexual life. That can be actually corrected. The second other important thing is, the sperm counts actually tends to decrease as long as you have more stress and then you are working out and then have a late marriage. So at around 30s, the sperm counts are almost 50% of what they are at around 25. So these are the two major issues which actually creep up in the middle age, which are actually age related other than what I have listed in the previous segment. Now the older age scenarios, there are two important issues. One is the functional issues and other is the malignancies. Now, these are the people who tend to develop some sort of cancers. These are the age which develop cancers in terms of kidney cancers, in terms of bladder cancers, prostate cancers. Unfortunately, by the time we get symptoms, these are way beyond our treatment paradigm. We just have to give palliative therapy. But luckily, with the newer advent of our health check protocols and all, we are able to pick up a lot of these people at a much earlier stage, so that we can actually afford a cure. Even in a small kidney cancers, we can actually afford a cure. The second part of the older age scenarios is the functional part, is mainly with the urinary issues, and they're also coupled with constipation. So both have to be tackled. Constipation has to be tackled because significant number of these elderly gentlemen who have constipation have urinary issues. They have frequency or urgency, they have incontinence, or they have difficulty in passing urine, and they get up multiple times at the night, which actually disturbs themselves and also their partners. So so these are the primary basically age-related issues which come in the men's health at the elderly age.
Yes. So just now, as you discussed about incontinence, can you please let us know what are the potential causes and risk factors of urinary incontinence in men, and are there any treatment options available for it?
I think I'll answer the second question first, that all these things are totally treatable. So now we'll get back to what are the reasons for incontinence in men. The primary reason for incontinence in elderly gentlemen is the prostate. What happens when the prostate slowly grows? Every man would have a prostate and it has to grow with age. None of us can get away from that. So once it grows in age, it starts to tend to narrow the urine passage. Once it starts to tend to narrow the urine passage, the bladder starts pushing the urine at a much higher pressure. It's like actually doing a workout that you actually start lifting weights. The same way the bladder is actually pushing against it. So you're pushing something against a resistance. So bladder is pushing against a significant resistance. The bladder becomes thick and then it becomes unstable. So what happens is there is a significant increase in pressure, and people who sit and then get up, they suddenly have to run and pass the urine, or any other trigger would make them go as an emergency, and before they go, they would leak, which actually is termed as incontinence. Very rarely, the other part of thing is when people have a spinal cord disorders or they have a spinal cord injury, then they have incontinence, but that is a total different subject out of men's health. So once we neglect these things, now what happens if you think that it is a standard age-old scenario, let me get through it. Over a period of time, the bladder actually becomes, it's like that you keep on working and you get tired and still you keep on working, at some point you fall down. Now, how do we fall down? One of the organs, the muscles fail, so you fall down. It's the same thing with the bladder, that it keeps on working. At some point of time, it says, I'm tired, I cannot work anymore. It becomes big, and then at that time, people develop retention. That means they cannot pass urine at all, and then they come back with big bladders, and then that hits the kidneys, and then they'll have kidney failure. And these are the ones which we cannot really fully treat. But in an earlier phase, if someone seeks an attention when there is a little incontinence or little difficulty in passing urine or little blood in urine, I think these are totally treatable, almost 100% treatable, if I have to say. Maybe the treatment modalities may be different in terms of whether medications or probably surgical options, but they are totally treatable.
What are some of the common risk factors for kidney disease in men?
Okay. Now, common risk factors for kidney disease in men are very simple. One is diabetes, untreated hypertension, because slowly they will start causing problem to the kidney. All people who have a kidney disease would have hypertension. That's a common paradigm for everyone, common denominator to be exact. So the other important things are, one is smoking. Now, what smoking does to a kidney is actually brings down the caliber of the blood vessels to the kidney, thus increasing the blood pressure. The moment the blood vessel becomes narrow, the kidney tends to produce an enzyme to increase the blood pressure so that all organs are actually perfused properly. So smoking is one other thing which actually causes hypertension and then kidney disease. Then it can cause kidney cancers. And if people who actually keep on going around in some dye industries and then who inhale dyes, these are the people who can develop a little bladder tumors and also kidney tumors. Then nothing other than that, they're not very specific that this would happen in males. So the standard lifestyle precautions and then advice would actually prevail for any kidney disease patients in males.
What are the common symptoms of prostate problems in men, and what steps can men take to promote good prostate health?
The common problems of the prostate, as we discussed, are that it can cause urinary disturbances like, number one, decrease in the flow of urine, difficulty to pass urine, then urgency that you'll have to run to the bathroom, then incontinence that you may not be able to hold urine and then you leak at inappropriate places, and then it can cause total retention or inability to pass urine. And all these actually let alone a significant number of them would cause a kidney failure, because it's like that you have the reservoir and then you're just putting a lot of pressure on the reservoir with the tubes going to the kidney. So you block it, obviously it's going to hit the kidney. So all these issues, if neglected, will actually hit the kidneys. So this is one aspect of the prostate. The second, sometimes we can see blood in urine. Now we will actually talk about a little of blood in urine. There could be one which you could see blood in urine, or when sometimes you get your health checkup done, you probably can see few RBCs in urine. Now that's called microscopic hematuria. A microscopic hematuria in an elderly male has to be looked at, and we have to rule out any amount of small cancers which are in the body. Either it could be bladder, or it could be ureteric, or it could be kidney, because this is a harbinger of malignancy, and then we can at least, body is showing some signs that there is something going wrong, please check us out. So this is one other thing which we'll have to look at. In macroscopic hematuria, that means what you can see, you see blood in urine, it could be rarely prostate cancer, but the most common thing is the bladder cancer and the kidney cancers. So blood in urine, unless proven otherwise, we need to see that there are no cancers in the body, in the urogenital tract, and that is what is more important.
What are the risk factors for developing prostate cancer?
Yeah.
And what measures can men take to reduce this risk of developing prostate cancer?
Okay. Now, there are very few theories which actually have come up saying that these probably can cause prostate cancer. Few of those theories actually are that you can have a malignancy because of smoking, a higher intake of fat, and more so animal fat is again linked to higher risk of prostate cancers. Higher intake of red meat, more so like beef and pork, and also lamb to a certain extent, and more so smoked meats if at all someone is actually having these kinds of the barbecue ones and all that. So they are the ones who probably have a higher risk of prostate cancers. Now let us also look at the genetic lineage of the prostate cancers. Now we have some amount of genetic profiling which we can do, and a good number of these patients who come to us, we actually look at genetic profiling. These cancers, we do something called genetic testing, which is of a BRCA1 or a BRCA2 and HRR, and there are multiple gene panels. Now what these do is they actually tell us whether these particular individuals who have cancers are an indolent cancer, or is it going to be really a progressive and it is aggressive. The second important thing is we can always test and tell that whether these genes, if they are present in their children, they are at risk for higher risk for prostate cancers. Now at that we can actually screen these particular individuals from an earlier age, so that we can actually pick them up early and then deliver the treatment. In early prostate cancer, we generally talk of cure, and the most important and the simplest thing is to get a robotic surgery done, which is very comfortable to get it done, and then we have a very good continence rates in about 95 to 98%, and then the complication rates are at 1 to 2%. So for a localized prostate cancer, we are talking about that it's a cure, and then we can always genetically profile that particular gentleman and also look at whether this family is at risk or not.
Thank you, sir, for sharing your valuable information on men's health.
Thank you very much. Thank you.
Hope you all have gained a valuable information on how to maintain men's health. Let us meet up in the next episode with one more interesting topic. Please do reach out to us with your queries through the comment section. Thank you.